I'm Peg Bolgioni, Communication Specialist with Rutland Regional Medical Center, and I'd like to welcome you to Window on Wellness. Our program will focus on the coronavirus, and I will be joined by Medical Director of Hospital Medicine, Dr. Rick Hildebrandt, and Jody McIntosh, Infection Preventionist. We'll be back with our guest after this message from Rutland Regional Medical Center.
Welcome to Rutland Regional Medical Center. We are Vermont's largest community hospital with 37 specialty clinics. Healthcare organizations have always fixed people once they're broken, but at Rutland Regional Medical Center, we do more. We provide nutrition counseling, weight loss help, smoking cessation classes, all the things that help the community and individuals stay healthy. And we do it all with this promise: to listen, to respect, and to care, always.
Welcome back to Window on Wellness. I'm very pleased to have Dr. Rick Hildebrandt, Medical Director of Hospital Medicine at Rutland Regional, and Jody McIntosh, who is our Infection Preventionist. Welcome to the show.
Thanks for having us.
We're going to be talking about coronavirus because I know that there's a lot of discussion about it in the community. It's been all over the news, and I think it's probably an opportunity for us to share with the public about, what people should be doing, how they should prepare, how they should prevent getting the virus. So I think we'll just dive right in. And I guess one of the first things is, how does the virus spread?
Sure. So coronavirus, or COVID-19, which is the name that was applied to this particular infection, is a respiratory virus that is spread the same way the cold or the flu can be spread, and that's by people coughing and droplets forming. Also, the virus can be transmitted through the air, so it can be coughed into the air and people can breathe it in. The biggest risk for people getting it is by their hands getting infected because they're touching infected surfaces and then touching either their eyes or their mouth.
Okay. And I know that there's been talk about people being quarantined. Maybe, Jody, you can kind of speak to that. I mean, what are the current guidelines around people being quarantined for the virus?
Sure. So the guidelines around quarantine are coming from the Vermont Department of Health and the CDC. So any patient who feels they have been exposed to the COVID-19 virus or who have traveled to one of the countries that has been hard hit with the virus, they are asked to self-isolate, and depending on their risk of exposure, the Vermont Department of Health will give them guidelines to self-isolate for, the recommended is 14 days.
So what does that mean exactly, self-isolate? I mean, they have to be obviously in their home.
Yep.
Or someplace where they're not exposing themselves to anybody. But what happens if they're with family or they're in their house and they have to self-isolate? So what kind of measures should people take to stay safe?
So family members within the home should really make sure that they're hand washing, doing some social distancing. So you don't want to be hugging, kissing, about 3 to 6 feet radius, washing your dishes, not sharing toothbrushes, not sharing cups, all of those things that you wouldn't do if somebody in your family had the flu. So you would not want to do those for if one of your family members had COVID-19.
Okay. Let's talk about the hand washing a little bit, because I don't think people know enough about doing it correctly. So I don't know if there's a system, or how long do they have to wash their hands? How should they wash their hands? Because that's something easy to do.
Mm-hmm.
Sure. So the recommended hand washing regimen is for 20 seconds, which is quite a bit longer than most people think. Some methods that people use is to sing the song "Row, Row, Row Your Boat," and by the time you're done, that's been about 20 seconds, and your hands should be clean. I recently saw a meme on the internet that said, imagine that you're chopping jalapeno peppers to make some nachos, and you're about to change your contact lenses. That's what you should be thinking of when you're washing your hands.
Okay. All right. That sounds good, actually. That's interesting. I like that. So I know that there's a lot of kind of fact versus fiction about the coronavirus. Are there any I guess, myths that you want to dispel to the audience about, what is true, what isn't, that people should be aware of?
Sure. I think the first thing to keep in mind is that it is not a widespread illness. The other thing to know is that while it is very contagious, doing things such as stockpiling masks is going to do very little to limit the transmissibility of this illness. Okay, so routine hand hygiene, using common sense measures such as making sure you're not exposing others if you do have a viral illness are of course prudent, but stockpiling on masks is going to do nothing to prevent the transmissibility of this illness.
And Jody, it's also too about, trying to keep yourself healthy.
Yes.
So can you maybe give us some recommendations for that?
Yes. So it's really important to get rest, good nutrition, good hand hygiene, keeping your hands away from your T-zone, so your eyes, nose, and mouth. You also, again, don't be shaking hands with everybody. So if the virus were to come to Vermont and you were in a town that had some cases, make sure you have good hand hygiene when you go out. Don't shake at church. Don't shake when you meet somebody. Again, no hugging. All those important social distancing things is going to be really important to keep your family healthy. The other thing you want to keep in mind is that if you have kids and they are not feeling well, they shouldn't go to school. If you're not feeling well, don't go to work. Because, as Dr. Hildebrandt mentioned, this virus can spread very easily. And if you take the virus from your home to your work or school, it can spread very quickly.
Has there been any, updates, any new information that you have learned about the virus itself?
So I think there's a lot that we don't know about the virus, and that's one thing to keep in mind. We have some information, epidemiologic information or information on statistics that come mostly from China, but that information is fairly limited. The information we do have indicates that the severity of this illness is on par with that of a bad flu, but really we don't have a very good grasp of a lot of the details because it's very rapidly spreading, but it's still a relatively new virus. Coronavirus as a virus is a common virus that we experience all the time that causes the cold, but this particular virus, the COVID-19 virus, there's a lot of information we don't have on.
And I know that I've heard that they're trying to develop a vaccine, they're trying to develop antiviral medications. What is the timeline for that? That I would imagine that's not going to happen next week.
Right. So in terms of vaccines, we are still in the heart of flu season. I would really encourage everyone, every listener, get your flu vaccine. That is the most important thing right now. Okay, that is a highly preventable illness that causes mortality in tens of thousands of people in America every year. There is no vaccine for this. There is no directed treatment for this. We have supportive treatments. The people who are most adversely affected by this virus are generally those who are elderly, those who have chronic illnesses, and the people who get very serious illnesses from this are generally superbacterial infections, so bacterial infections like pneumonia that happen after someone gets this virus. So for those individuals, they of course should seek medical attention, either with their primary care physician, or if they cannot breathe, they should come to our emergency department for emergent care.
Now, I know that we're working with the Vermont Department of Health so we're getting a lot of our information from them. So Jody, how is that relationship how is that set up, in terms of how we work with them?
Yep. So the Vermont Department of Health has a 24-hour number that they've provided the public, and we can utilize that number to ask them about any questions we have. The public can call. They also can use 211, which is another resource, and the Vermont Department of Health has a very robust website with a lot of information. I have in contact with Vermont Department of Health daily, and They provide us any updates that we need around testing, time frames, patient populations. So it's a very close relationship, and they also get their guidance from the CDC. So CDC tells Vermont Department of Health, tells the local infection preventionists.
So if somebody shows up at the emergency department and presents symptoms, let's sort of follow the testing pattern. How does that happen, or what occurs?
So first of all, keep in mind that if someone has symptoms of coronavirus, those symptoms are runny nose, sore throat, cough, muscle aches, fever, okay? Very similar symptoms to that of the flu or of a cold. If you have an illness that is on the order of magnitude of a mild cold, we would encourage you strongly to call your primary care physician and not come directly to the emergency department. If you are very ill and are in need of emergent care, of course, you would come to the emergency department. For folks who have had travel to the relevant affected countries, we would do a screening questionnaire to find that information out. And with that and the relevant symptoms that are associated with this virus, we would call the Vermont Department of Health. And they would give us guidance as to whether or not we should institute testing for any patient. For testing, the labs are collected and sent to the state lab. And then we would hear back from the state lab the results of that test.
And if somebody is positive, then what are the next steps?
Right, so again, the treatment is supportive in nature. So when someone is hypoxic or their oxygen levels are low because let's say they have a chronic lung disease and they have a bad infection from this virus, we would treat it as we would anybody who comes in with hypoxia. We see that all the time with influenza, and we would provide supportive care, which may be supplemental oxygen, it might be IV fluids, it may be antibiotics if we've identified a superbacterial infection in the hospital. Most patients who get this infection would not require hospital level of care. They will have the illness, it will be self-limited, and it will go away on its own with simple hydration and supportive care at home.
What's the recovery period?
So again, something we don't have a lot of information on, but it appears to be on the order of about 7 days from someone to go into the convalescent phase, depending on the specific factors of the person. The quarantine period is 14 days because that's really the longest period of time we expect someone to be infective.
And so I know the hospital is, working on implementing, certain protocols. Can you expand on that at all, what we're doing here at the hospital?
Sure. So you can expect to be screened either at your outpatient appointments, at doctor's visits, and that is going to be a screening for if you have any of those symptoms, so cough, cold, fever, and have you traveled, or has anybody of your close contacts traveled to China, Japan, Italy, Hong Kong, Iran, and based on those screening questions, depending on if it's yes or no, we have developed protocol on how to provide the care for you. And we actually will be implementing pre-screening calls depending on the level of, if the virus comes to Rutland and there's lots of people in the community that are ill, we want to reach out to you and screen you before your appointment to make sure you're getting the appropriate care and remind you that if you are sick to be seeing your primary care provider. We also want to make sure that any visitors coming to the hospital are well. So if you are sick and you have a loved one here at the hospital, we want you to really think about not visiting when you're sick. And that protects not only your loved ones, but the other patients and the employees at the hospital not getting exposed to sickness.
And I guess, are there any important takeaways that you wanted to impart to the audience, about the coronavirus? I think we've covered, pretty broad spectrum of information, but any final thoughts?
So again, I would encourage people to think of this on the order of a bad case of the flu, to use common sense. Hand hygiene cannot be underdone. Wash your hands, especially if you're in contact with those who are coughing. If you are ill, avoid coming to work or infecting others as you would if you had the flu. If you're have a mild illness, call your primary care physician for direction. If you are very ill, if you cannot breathe, that is the threshold to come to our emergency department for further evaluation and testing.
Okay. Jody, did you have any final comments?
Wash your hands, wash your hands, wash your hands, and don't touch your face.
All right, and it's still not too late to get a flu shot.
Always come in and get a flu shot if you haven't already.
All right. Thank you both for joining me here today and for the information. I'm sure that the public will benefit from it. And have a great day, everybody. Thanks for joining us on Window on Wellness. Please continue to watch us on PEG TV and on demand at pegtv.com.